The learning objectives of this session are that at the end of the session, students should be able to describe and enumerate the boundaries and contents of the popliteal fossa, describe the course and branches of popliteal vessels, tibial nerve, common peroneal nerve in popliteal fossa, and correlate the anatomy of the popliteal fossa with the clinical aspects. Popliteal fossa is a shallow diamond-shaped depression at the back of the knee joint, and it is felt best when the knee joint is semi-flexed. So this is the popliteal fossa, and it is diamond-shaped depression. The boundaries of the popliteal fossa include: supralaterally we have biceps femoris, which is a muscle of the back of the thigh, also called hamstring muscle, which you already have studied. Then infralaterally we have two muscles, plantaris and gastrocnemius muscles, lateral head. Both of these muscles are muscles of the back of the leg. Then supramedially we have two muscles, semimembranosus, semitendinosus. These are also the hamstring muscles. Then inframedially we have gastrocnemius, medial head. So all these muscles, they form the boundaries of the popliteal fossa and enclose a shallow diamond-shaped depression, which is the popliteal fossa. Roof of the popliteal fossa is formed by skin, superficial fascia and deep fascia, which is also called popliteal fascia. The roof have numerous contents in it, which include sural communicating nerve. This is the sural communicating nerve. Then short saphenous vein, posterior cutaneous nerve of thigh, and posterior division of medial cutaneous nerve of thigh. These all are included in the roof of the popliteal fossa. The floor of the this is formed by all these structures that you can see in this diagram, including the popliteal surface of the femur, capsule of knee joint. This is the oblique popliteal ligament. Then this is the popliteal fascia over the popliteus muscle itself, and tendon of the semimembranosus muscle. So these structures, they form the floor of the popliteal fossa. Now that we are done with the roof and floor of the popliteal fossa, let's move to the other contents, the main contents of the popliteal fossa, which are: first, you can just see this is the popliteal fossa with its boundaries. The contents include lymph nodes, popliteal lymph nodes, then common peroneal nerve. This is the common peroneal nerve, which traverses along the medial border of the biceps femoris muscle. Then we have popliteal vein, popliteal artery, tibial nerve, and fibrofatty tissue. All these comprise the contents of the popliteal fossa. As you can see in this picture, the tibial nerve and the popliteal vessels, they transverse the popliteal fossa vertically, and their relations in the popliteal fossa are: in the upper part of the popliteal fossa, the relation are from medial to lateral. The relations are: popliteal artery lies on the most medial side, then the popliteal vein, and tibial nerve is most lateral. So AVN, artery, vein and nerve, is the relation of these vessels and nerve in the upper part of the popliteal fossa. In the middle part of the popliteal fossa, these three structures are arranged one on another. If you can see, tibial nerve is most superficial, then we have popliteal vein, and the deepest is the popliteal artery. So the relation is NVA, nerve, vein and artery. In the lower part of the popliteal fossa, the relations are: the tibial nerve, which was in the upper part the most lateral structure, is now the most medial structure. Then we have the popliteal vein, and then the popliteal artery. So the relations in the lower part are most medial, tibial nerve. In the middle we have vein, and on the most lateral side we have popliteal artery, NVA. So this diagram is very important if you want to understand the relations of the popliteal vessels and tibial nerve. Popliteal artery is a continuation of the femoral artery at the adductor hiatus. This is adductor hiatus. What is adductor hiatus? Adductor hiatus is a hiatus or a hole or a gap in the adductor part of the adductor magnus muscle. When the femoral artery passes through this adductor hiatus, it changes its name and becomes popliteal artery. Popliteal artery, it runs downwards to the popliteal fossa, and then at the lower border of the this is the popliteus muscle, at the lower border of the popliteal muscle, it ends and divides into its two terminal branches, which are anterior and posterior tibial arteries, which continue in the leg. The branches of the popliteal artery are very important because they take part in anastomosis around the knee joint. So there are genicular branches. We have superior medial genicular and superior lateral genicular branches. We have middle genicular branch, inferior lateral genicular branch, and inferior medial genicular branch. These branches, as I have already told you, take part in anastomosis around the knee joint. Then we have superior muscular branches. Superior muscular branches, they anastomose with the perforating branches of the profunda femoris, and they form anastomosis at the back of the thigh. Then we have sural arteries. These are sural arteries. Terminal branches. Terminal branches, we know they are anterior and posterior tibial arteries. I've already told you. Then there's another branch given off by popliteal artery, which is a cutaneous branch. So the most important ones over here are the genicular branches, which take part in anastomosis around the knee joint. Tibial nerve is a branch of sciatic nerve. So its root value is ventral division of ventral primary rami of L4, L5, S1, S2 and S3. As I've already told you, it is a branch of sciatic nerve and it is a larger terminal branch of sciatic nerve. It extends from the superior angle of the popliteal fossa to the inferior angle of the popliteal fossa, and then it continues in the leg. So, and its relation in the popliteal fossa have already been discussed earlier. The branches of tibial nerve are genicular branches, which there are three genicular branches: superior medial genicular, middle genicular, inferior middle genicular. Then we have cutaneous branches, which is also called sural nerve. It supplies the skin of the lower half of the back of the leg and lateral border of the foot till the tip of the little toe. So it gives cutaneous innervation to the lower half of the back of the leg and lateral border of foot till the little toe. Then muscular branches are also given by tibial nerve, which supply muscles such as gastrocnemius, soleus, plantaris and popliteus. All these muscles are muscles of the back of the leg. Common peroneal nerve is another nerve present in the popliteal fossa. Its root value is ventral division or ventral primary rami of L4, L5, S1 and S2. It is again a branch of sciatic nerve. So it is a smaller terminal branch of sciatic nerve. It extends from the superior angle of the popliteal fossa to the inferior angle of the popliteal fossa, but it runs obliquely along the medial border of the bicep femoris muscle, and I have already shown you in the previous pictures the relation of common peroneal nerve to the bicep femoris and the vessel and the popliteal vessels and tibial nerve. So you can go back and see and once again go through those relations. Then at the lower border, at the inferior angle of the popliteal fossa, it winds around the neck of fibula and divides into two terminal branches, which are superficial and deep peroneal nerve. So its terminal branches are superficial and deep peroneal nerve that run in the leg. Branches of the popliteal fossa include genicular branches, which include superior lateral genicular, inferior lateral genicular and recurrent genicular. It has cutaneous branches, which include lateral cutaneous nerve of the calf, which supplies upper 2/3 of the lateral side of the leg. Then it has sural communicating nerve, which supplies the posterolateral aspect of the calf. Muscular branch, and it also gives off muscular branches. So both the nerves, the common peroneal and tibial nerve, they give off genicular branches, cutaneous branches and muscular branches. And as common peroneal nerve is on the lateral side, so it gives off lateral genicular branches, whereas the tibial nerve is on the medial side, so it gives off medial genicular branches. The clinical anatomy. Popliteal aneurysm. Let's discuss popliteal aneurysm. Popliteal aneurysm is an abnormal dilation of all or part of popliteal artery. As you can see, this is the popliteal artery. If it gets dilated, an aneurysm is formed, which is it is called popliteal aneurysm. How do we distinguish a popliteal aneurysm from other masses that are present in the that could occur in the popliteal fossa? First of all, a popliteal aneurysm, when you palpate it, there will be pulsations or thrills will be felt. Secondly, abnormal, when you check with the stethoscope, abnormal arterial sounds, which are called bruits, can also be heard. So these two are the distinguishing points between a popliteal aneurysm and other masses that could be found in the popliteal fossa. Then there is another mass that could be found in the popliteal fossa, which is called Baker's cyst or popliteal cyst. What is it? It is an abnormal fluid-filled sac of synovial membrane in the region of the popliteal fossa. So if you can see, in the region of popliteal fossa we have knee joint. This is the synovial membrane of the knee joint. And over here you can see that the synovial membrane has been filled with abnormal fluid and a sac has been formed, forming a Baker's cyst. So, and on the surface you can see the Baker's cyst. Baker's cyst is almost always a complication of chronic knee effusion or arthritis. Symptoms of Baker's cyst include pain in the knee, inability of flexing the knee joint and stiffness. So you feel pain and stiffness. Then a round-shaped golf ball sized swelling is felt in the popliteal fossa. As you can see in this picture, this is the Baker's cyst, a golf-sized round-shaped swelling, and the joint flexibility is reduced because of this popliteal cyst or Baker's cyst. In the adults, this Baker's cyst can extend up to the midcalf. As you can see, this is the Baker's cyst, which was at the back, has now extended up to the midcalf, and it could also be ruptured. And the rupture may result a swelling in the calf, as in this picture. Along with the swelling, there can be bruising below the medial malleolus. This is medial malleolus, and below the medial malleolus there could be swelling, and this swelling and this sign is called crescent sign, or this bruising is called below the medial malleolus, is diagnostic of Baker's cyst rupture, and it is called crescent sign. So let me repeat it once again. Baker's cyst is a small golf-sized swelling at the back of the knee or popliteal fossa. One experiences pain, stiffness, and inability to flex the knee. Then if it ruptures in adults, then there can be swelling in the calf and bruising below the medial malleolus of the ankle, which is the crescent.